Welcome to the Mug Hub podcast, the ultimate platform for all things related to medicine's use, patient care, and the incredible world of pharmacy. We are your hosts, Connor and Sian, and we're thrilled to have you join us today.
Here at the Mug Hub podcast, we're passionate about empowering future pharmacists, expanding your knowledge and igniting your curiosity. Whether you're a first year embarking on your pharmacy journey or a final year getting ready to go out into practice, this podcast is designed just for you.
Across our series, we delve into 4 captivating themes that will take you on an enlightening and entertaining journey. From exploring intriguing clinical topics to showcasing the extraordinary individuals who make up our incredible teams, we're here to unlock the secrets of the pharmacy world.
So grab your favourite mug, settle in, and let's embark on an incredible voyage together. Get ready to be inspired, educated, and motivated as we unlock the vast potential of pharmacy and the vital role it plays in healthcare. Okay, today on the Mug Hub, we have Safoora Azimi, who is a member of our teaching staff in medicine's use, is a senior lecturer in medicine's use and a practicing GP pharmacist. So thank you, Safoora, for coming in to our little sound studio for a small interview or chat, as we like to call it.
Interview is such a great way of putting it. That makes it very formal.
It's very formal.
Chat's
I'm
much
feeling
better.
formal today. You know, I've had enough time off that I'm ready to be formal.
Where's your suit? Not that formal. Okay.
Maybe I will start wearing suits. We'll see. Safoora.
Yes, hi.
Hi, how are you doing?
Yes, it's lovely to be with you today and I'm quite excited about it.
Oh, we're very excited to have you, mostly because of this GP slant that you have to your work. So quite excited to learn a little bit more about that. But first, do you want to tell us a little bit about your career so far and what you did after graduating from, I think, from Brighton? Yeah.
Yes, that's right.
And how you got to where you are now.
Okay, so the first thing is that pharmacy is not my first degree. So I did a degree in environmental science to start with. I did work as an environmental researcher before I decided to change my sector. And so then I decided to study pharmacy and I did like to do it in the UK at that point. So when I did my pharmacy, I wasn't really very sure to start with where I was going to work. So at that point, really it was just community and the hospital. They were the options. We didn't have that many options that we do have now. And I was quite interested in pharmaceutical industry as well when I started the job, the study. While I was studying at pharmacy in the University of Brighton, then I had all these placements and I actually found myself very interested in the clinical work rather than pharmaceutical industry. I thought that suits me better because I felt I really like to talk to the patients and make a difference to the people's lives. When I was on my third year, we had a module called, if I'm right, I'm not sure, Connor maybe remembers better than me. It was called psychiatric pharmacy, I think, in our time because we had modules. And I actually had that with Railton. He's great. And I became very interested in mental health. So I always tell to Railton that you are the one who actually encouraged me in getting a specialist in mental health. He was a very big influence on me. So I became very interested in mental health and I thought that's something maybe I want to do in future. When I finished, I did my pre-reg and things in hospital, in Eastbourne Hospital. So because as I was always interested in mental health, I decided to move from general hospital in general to the mental health. And when I was doing that, it was a bit of difficult to join the mental health as a junior pharmacist. They were not really that great employment at that point. They usually wanted experienced pharmacists to join them. So I was very lucky because I could get a job as a Band 6 pharmacist at that point in Surrey and Borders Partnership Foundation Trust. So I moved from my lovely West Sussex and Beachside to the Guildford. And I did my first part of postgraduate study in Guildford when I was working there. And I did work in the mental health trust as in the inpatient unit, outpatient units, and it was very varied. So like alcohol detox units, I really did enjoy that. But I always missed coming back to Brighton and in general being around West Sussex area, because many of my friends, they live in Brighton. So I had to travel all the way from Surrey to there.
Definitely. Everybody seems to come back to Brighton at some point.
Honestly,
it does happen
everyone.
a lot.
Yeah,
Yeah.
exactly. Everyone does that. So I did look for the job at that point, and I got a job with Sussex Partnership Foundation Trust, and I came and I covered hospitals in their inpatient unit and outpatient unit as well, a community center, and I also covered the learning disability unit. So that's why I was very interested in the prescribing in learning disability as well. So I did my clinical diploma in psychiatric pharmacy with Aston University. I think it's the only university offer that. I'm not sure if changed now, but at that point that was the only university. And it's quite, anybody wants to do that degree, I would say it's quite very intense and difficult diploma to do, perhaps one of the most difficult ones. Yeah, they expect a lot. I hope they're not hearing it now.
Safoora, what was difficult about it? How did you go about like choosing Aston for your postgraduate diploma? I mean, you said that it was the only one that was offering the mental health aspect to it, and you said it was quite intense, quite difficult. What was difficult, did you find, about it?
So the first part of it, anybody can do that degree. It's called, I don't know if I remember the exact name of the degree, but it's like a postgraduate certificate in psychotropic therapeutic, something like that, and that part anybody can do it. So some of the GPs also, they do that as well. So it's more about all the mental health illnesses and their treatment. The second part, which is called clinical diploma in psychiatric pharmacy, they are completely different degrees, so they're not usually like a usual hospital degree, that this is continuation of that. And that one is very intense in terms of, first of all, they are harsh markers a little.
Okay.
So usually you have to do a lot to get a good mark. And also it involves a lot of work, like lots of writing essays and lots of things you need to do in practice and reflect on them. It's a lot of work to do for a very short period of the time.
Okay.
So that's a part of it. It's quite difficult, and as I said, it's a little like you need to do a lot to pass.
But it sounds like it's been useful in directing your career into the mental health.
Oh yes, they are very, very useful. I mean, every pharmacist that work in mental health, they usually do those courses, because that's the way you specialize in mental health, and they are very, very helpful. Like they open your eyes to a lot of things, and it's not just about mental health; it's generally into the research in clinical practice. I did that, and I was working in there. So then I met a few people from the GP surgeries, and they were saying to me, at that point they were not pharmacists, they were not very popular in GP surgeries. So NHS has induced a scheme to the GP surgeries that if they employed a pharmacist, at that point I think was they would reimburse 70% of the salaries. So there was some help for the GP surgeries. And they told me that, because you have experience in mental health, you can join us, and we don't know much about mental health as a GPs usually, unless if somebody is really interested in mental health, and you can look after our mental health patient, most of them. So I did move to the GP surgery, but and I was looking after most of their mental health patients. So if there was somebody coming to the surgery, I would see them first, and so that was a part of my job. But working in the GP surgery, you do a lot of things rather than that. So you are a little like a GP. I always say the line between a GP surgery pharmacist, especially if you're a prescriber, and GP is really very narrow. So you would end up doing a lot of things. So so then I work in the GP surgery, and I did really enjoy it. I think that was really suited me very well. And I felt that it was very appreciated by the GPs in general, the work as well. So then I joined the academia. So The academia part came in. I did approach my lecturers, a couple of them. I wanted to do a PhD, and they said to me that I wanted to do a PhD in mental health, and they said to me about this position. And they said, if you want to apply, then you can do this as a job. And I did like teaching as well. And they said, also, you can do your PhD as a part of it as well if you want. So then I applied and I was lucky enough to
I don't think it's luck. I think there's a very rigorous interview process, and you got it on merit, no doubt.
Yes, it was a difficult interview. Yes, I would say.
Interesting. Well, I got another question for you on this, Safoora, because that sounds like quite a lot to have done, but you are quite young still. So what period of time was that covering? How many years since graduating took you to here?
I think it falls into the 6 years now. Yeah, something like 6 years.
Yeah.
I also find it very fascinating that from third year you've decided that mental health is where you're going, and then you've kind of found your niche, found what it is that you enjoy and you're excited by it, and ran with it. So for me, it wasn't until Band 7, so 2-3 years after qualifying, that I decided that liver was for me. So I think that's quite interesting that even as an undergraduate, you knew what it was you wanted to do, which is fantastic.
Yes, and I think also like when I did my pre-reg, perhaps I think you've done that in Eastbourne as well, Connor.
Yeah, it's fun that we both did our undergraduate at University of Brighton and both
interesting. Both went to Eastbourne.
So that was interesting. Was in Eastbourne they do also mental health rotation, so we had 1 week of mental health rotation, and that was my favorite rotation. I did really like it, so also like that a little solidified that I want to be in the mental health as well.
And that was 1 week probably as well, wasn't it?
Yes,
so
it was 1 week.
You went, this is for me.
Yes, I know. I always I was like the mental health. I find it fascinating first about the drugs that they work in mental health illnesses, because they're not very much like a hypertension medication, for example, you give, they reduce the blood pressure. The mental health medication are very individualized, so people's responses are quite very different, and I find it very enjoyable that you have quite lots of contact with your patients, and you also see them how they improve. So you have sometimes like patients who are very depressed, and then you see them that they get well, and it's really very enjoyable experience to make a difference to people's life.
As a non-pharmacist, I think I'd find that quite scary. And like what you're saying there, that with the hypertension medications, you're pretty certain what it's going to do to somebody. But having that variability in response, I think would freak me out. I'd be a bit scared to be prescribing or giving anything.
Yes, and that's a little scary for many people. Like it's just also they could be quite very harmful. Like antipsychotics, when we prescribe them, they can cause a lot of side effects. So that's something I found when I work in the general practice as well. Some of the GPs also found it a little scary to deal with the mental health patients and their medication. So. That's what I think they really appreciated my input, because I was doing it on their behalf.
I should think they were quite sad to see you go.
Yes, it was. It was really and what I think is very interesting as well with the mental health field when you're working in that is that not everybody can take over your work. So like if you're not there, then that makes a massive difference, because then other people get used to you to being there. And when I was going on holiday or something, it was like a little like a panic, like what they are going to do with my patients.
I can imagine, yeah.
I think that kind of leads really nicely onto the next question then, which is about what a typical day looks like. So you've mentioned about going on holiday, and I think you call it caseloads?
Yes.
What does a typical day of a GP pharmacist look like?
Okay, so what I would suggest to students that they have a rotation if they can, or like a work experience GP surgery. The good thing about GP surgery is that you can move to GP surgery at any stage of your career. So if you're working, for example, in hospital and your specialist is any field, you can take your specialty to GP surgeries because they will love it. For example, like yourself, Connor, if you're a specialist in liver disease, then you go work in GP surgeries. because then they would allocate all their difficult patients to you, and they would be very happy because, again, GP, as it stands, is general practitioner. They don't know much about specific specialities. Or if you be a pediatric pharmacist, then you can take over like the children in there. So it's quite very interesting that you can take your work with you. If you even as a pharmacist you end up working in hospital, you can always think about changing it. Don't feel scared about changing it, because if you're a specialist or highly a specialist, you can always take it with you. So the typical day depends on very much on which GP surgery you work for, and also like yourself as a pharmacist, how happy you are to take responsibilities. So if you're happy to take lots of responsibilities and you feel confident about prescribing, and the GP surgeries also recognize your, what you want to do, is usually you can a little dictate what you want to do for the GP surgeries at some degrees, especially when I joined, because they didn't have pharmacists that much before. So you could tell them what you are happy to do for them. And you can always suggest them. If they didn't offer a specific area of work to you, you can ask for it yourself. So it's very flexible about what you want to do. You have a high degree of flexibility about it. So the day depends on, again, how you manage it. So what I used to manage when I was a full-time GP surgery pharmacist, I used to have clinics every day. At the time of the COVID, I usually see the patient face-to-face if I thought they need to be seen face-to-face. So it was really up to me. So I had like a clinics, and it was always very busy. At the start, I used to put them as like 10-15 minutes a slot, but because it was so busy, we got to a point that we wouldn't book a specific time for them. So it was just a list for me of the patient that they wanted to talk to me.
Wow, and they weren't timed.
No, they were not timed anymore. So what I used to do, like I used to just have a very big list of them, and the receptionist would tell the patient that I would talk to them sometimes today. So it wasn't really
That's
like...
interesting, isn't it? Going down from having a specific time to just having a list. I would have thought that would up the chances of the consultations taking longer, no, or not?
The reason we changed it like that, then I could have flexibility. So because it was just not mental health patient, they were every type of patient. So for example, if I was doing a couple of really difficult mental health patient, because with mental health sometimes you have people who are very distressed. I had patients like on the phone that they were suicidal. I drove all the way to their home and take their tablets away. So there are lots of things that they can come up sometimes. So that gives you the degree of flexibility to, if you have done few mental health patients and you feel a little overwhelmed, then you could do like other type of patients in between, and clear your mind a bit of fresh. And also like some appointment they might take longer, but then some appointment may take shorter. So when I was looking at the list, I had a clue roughly that how long they are going to take, so I could manage them based on how I'm feeling during the day, and if I want to take it short or long.
Do you prioritize those, or was it just that they were a list? And then you mentioned that you can kind of guess how long they would take. Were you given a summary? I mean, I have no idea how patient lists work in a GP. So
yes, ideally, I don't say that would always happen. Ideally, the receptionist, when they book the call, they should write a little, like a sentence or so about what the call is about.
Sure.
So they used to write it, and they do same for the GPs, but sometimes they might not do it, or they don't write it properly. So we did have, so I was always shouting around, writing announcement, please, if you book appointment with me, write a little about what is it about, rather than just walking into unknown.
Yeah.
So they usually write it, so I could guess about what they are. For example, if I have a lot of time you get in the GP surgeries, like they are on a statin, for example. Imagine they are on atorvastatin, and you can see that is a muscle pain is written. Then I know, like in that case, if there are no other contraindication, I'm most likely, for example, I'm going to try rosuvastatin. So I know this is a short conversation. So when you look at it, then you get some ideas like how. But if I see somebody is written down, the patient is feeling low mood or anxiety and is never had any diagnosis, so I can guess that this is not a 10 minutes, it's roughly going to take longer than that. So yes, it is like, I wouldn't say it's always easy. Sometimes I had a big list and I would running behind. In that situation, then I would have asked my GP colleagues to pop in. So I could always ask for their help, like a duty doctor. I would say, like, message him, because in that system, one GP surgery is like a bit of like chatting, like WhatsApp a little. You can message them, and I would say message like, can you help in? And they would pop in. All the GPs, like we have 5 or 6 of them, and they all will come to my list and take over some of them. And sometimes I do this for them because GPs had a list. So if I had a quieter day, or if I see something on their list is mental health and they haven't booked with me, I would pop in their list and take over some of their patients. So that was a part of the job, but it's not the only limited to that. I wish it was.
Well, I can see why you said there's a fine line between a GP and a GP pharmacist. It does sound like an incredibly similar role.
Very, very similar. Yeah, that's very right, Sean. It's very, very... The only things like usually you don't deal with that is like some of the diagnoses. You might feel like you're not ready to do that diagnosis for them. But a lot of things are very, very similar. The role is very similar. Yeah, so that was a part of it, but it was not just limited to that. So in addition to that, I would still have, like, sometimes I would have prescription authorizations. So like I would deal with the acute requests for medication and prescribe them if they were appropriate. So that would be a part of the job. For example, like I had some, we call it tasks. So I would have a task would say, for example, a patient is suddenly out of blue is asking for amoxicillin. And you get that, honestly, you get a lot. So then I would deal with those. Sometimes I had to call those as well. So they were in addition sometimes to the usual clinic. So you might want to call them and see why they are asking for a specific medication.
So when you say they just suddenly out of the blue asking for it, it's come in as a prescription request from a patient?
Yes, exactly. And some of them, they come as a letter. So I used to get lots of letters as well, especially in one of the surgeries I used to work in Brighton. So they were very much letter-based. So in the morning, I used to go collect lots of letters. So they were like papers. Patient has written letter to me. And I used to collect them and go through them. So they were like a letter, people written. And like in their letters, sometimes they would say, I want diazepam, I want this, I want that. So
I kind of got an image of you with like a stamp and just like stamping approved, not approved, reject.
Yeah, so if I become very busy, sometimes that's what the GPs mostly they do. I try to not do it myself, but if it's very busy, the GPs would just direct receptionists to issue them. So for example, if a patient is asking for a medication and GP is happy to give it, they wouldn't issue it themselves on the system. So what they would do, they would just say yes, no, and there's someone in reception who is non-clinical, then they would issue those prescriptions. And then they would go to the pool of signing, it's online signing, so then duty GP would sign them. So the duty GP may sign lots of them adjunct, so it's quite sometimes not enough time to look at them.
Interesting.
Yeah, so that was a part of it as well. And then I personally, they didn't want me to spend lots of time doing medicine reconciliation because we had a team of non-clinical team, but they were trained to do clinical work. They used to do all the medicine reconciliations. What would happen with medicine reconciliations? When the letters come in, like patient has been discharged or there is a letter from a specialist, so they're usually non-clinical team, they would go and read them and they highlight the important part in red. So important part are usually if there is a change of medication or like they would compare it to the repeat prescription, and if there is something changed, they just highlight it in red. And then that would come to either me or the GPs and we decide if it's okay. So I personally, if they usually come to me if they were complex. If they were easy, most of the GPs would do that because I couldn't obviously deal with all the medicine reconciliation of entire surgery. So they usually, if they were easy, it would go to GPs. And as I said, GPs usually say yes or no, and the reception team would change them, which is a little risk with that because we had errors happening as a result of that. If they would come to me, then I would deal with them and I would change them. Sometimes I had to call hospitals. Another thing was I refer the patient. So sometimes I do refer the patient myself to the specialist team. So I had to write the referral letter and send it to the secretary to send to them. And or I would sometimes write a letter, like if I had questions, like I might write a letter, for example, to a pharmacist like Connor, a specialist, highly specialist in liver disease.
I just
That's asking for
ignore it.
trouble. Yeah.
No, I have done it before. Like I had questions specific about like use of medication in liver disease and what is beyond my competency. So I would write a letter, for example, ask the receptionist to email it to the liver team in hospital and ask a specific question. So
Isn't it terrible? It's just so, it's kind of old-fashioned, this language of like writing a letter. Is it? Where's that come from?
well, a lot of them are sent through emails now as well. So with what we do, I would send them to the secretaries. They are online, so as a task, and the secretaries then would email them to the specialist team. But the reason we do it through our secretaries, I used to email them it directly myself, and there was some problem with that, was that they would, even when I used to highlight in my email, please respond back to the general surgery email address, the consultants or the pharmacist, they still would email it to me.
Sure.
And it was really very not safe, because like if I was on holiday or something,
Yes.
I wouldn't come across to see them. So that's
Okay.
why we always go through secretaries, because the secretaries then email them from the general surgery's email.
I
And
love this idea of tasks as well. Everything's set up on a system to be like,
Yeah.
tick things off, I've done this, or can you do
Yes.
this? It's quite nice and accountable.
Well, yeah, and again, that's the accountability, the audit trail kind of thing. So if something does go wrong, you can clearly go back and see, has everything been followed? Interesting, yeah.
I've got kind of a follow-on on that, because you mentioned COVID at one point, and I'm very intrigued to understand what were the biggest changes from before COVID to after COVID for you?
yeah, it was a huge change, because when the COVID happened, we had directions from NHS that we were not supposed to see the patients face to face. So I think that was sometimes patient misunderstood, that it was not really the GP's choice as well, because patients were like GPs, you would hear sometimes they are hiding and stuff. But it was actually, we had a clear direction that we should just see the patient like only if it's absolutely necessary. So before the COVID, it was really very easy, because most of my patients, I would book them as a face-to-face if I could. And if I had problem, I would just ask the patient to pop in most of the time. Like, it was very easy. So most of the things, they were usually in the face-to-face capacity. When the COVID happened, then we had to adapt to become like telephone calls. At that point also the demand really very much increased, so it was a massive demand to change, and also demand from the patient. So we did move to the telephone system, which was like all the appointments are booked as a telephone appointment, unless if it's not urgent, or if we want to, unless if it's urgent and we want to see somebody face to face. So it will come to the decisions of the clinicians rather than receptionists. So receptionists would book them as a telephone call, and they would say like the patient was face to face, then we would decide about it. So that was a big change, and I found it a little tricky with my mental health patients sometimes, because it's really very hard sometimes to assess someone's mental health by the telephone. Sometimes I could do video calls with them as well, but it was very hard. Some people couldn't get the system right because in this technology. And I found it really very difficult sometimes to assess my patients, because when you see your patients, you can see like they are self-neglecting. That sort of thing, you will see them when you see them, and you will see that how they are feeling. But when you're not having that outlet, you're just hearing somebody's voice, it would be quite very difficult. Another thing I experienced about especially my mental health patient was that if they were suicidal. So generally, if a patient is having suicidal thoughts, but they don't have act of suicide or they don't have plan, we deal with them in general practice. So I would provide them advice about how to get help if they become suicidal. But if they don't have that, then they are really having plan or something, we refer them urgently to the mental health team. And during the COVID, it was really very difficult. The services were very limited. And other problem we had was with the camps is for mental health services for children. They were really very big waiting list for them. So a lot of times even the NICE says to us to not treat the children. A lot of times we had to make decisions that we wouldn't have this make decisions before COVID.
Was it that demand was higher, or that services services provision had been cut down, or was it a bit of both?
I think it was a bit of both, Sean. So the demand was a little higher. I think people were spending a lot of time in home, and they used to care a little about more things that they wouldn't have cared if they were working or they were outside. So I think people become a little more cautious about what's happening to them. In general, for example, they would see something, I don't know, a mole on their body. Maybe they didn't care too much about it before the COVID, but now everything, because they have so much time on their hand to think about.
Yeah.
That, and also there was a huge demand of mental health patients. I was very busy because the people mental health obviously deteriorated because of the COVID.
Sure.
And so that was another part was because the hospitals were also focused on the COVID. So a lot of department, they were not running as usual because they were deployed to the COVID wards, or it was on COVID. So they couldn't get hold of people in hospital or their specialist teams like rheumatology or some other teams. And then we were the only point of contact. So they could just, we were the only one who they were able to talk to. So that was also a big problem.
Gosh, I kind of want to move it on a little bit and tell me something about pharmacy that you really enjoy.
Well,
after that, quite
you feel a little deflated,
I
depressed,
feel-
do you?
Yeah.
Okay, you need a lift.
I need a lift.
Okay.
You need a lift now.
You've mentioned lots of great things, and I think actually the role of a pharmacist within a GP practice you've kind of highlighted as being quite clear. We've been through quite a dark patch through COVID, and it's made a lot of changes to the way things work. That you've mentioned that there's an increased stress and work demand, but I wonder what's the thing that you really enjoy about pharmacy?
I mean, in pharmacy as a general, or pharmacy like in GP surgery?
Say in GP.
In the GP surgery. I personally like the variety because I was focused on mental health patient, but I was seeing other patients as well. You learn a lot because you are dealing with variety of disease. So that's why I know a lot of things now about different disease, which I think I would never have got a chance to know about them. It's just because you get to, read the letters from a specialist.
Sure.
And the specialist always writes things about how they diagnose and stuff. So you learn a lot of things. It's very varied. And you get to use your skills really very good. So and there is a big trust in the pharmacist. That's something I personally liked when I worked there. Like the GPs, they have a big trust in you as a pharmacist. The GPs thinks that you always usually know more than them about things. So they really appreciate like the work you're doing. They have a big trust in the pharmacy, and it's also a huge patient involvement in that as well. So you are seeing a lot of patients with different conditions, and also it's quite very multidisciplinary because you work with GPs, nurses, paramedics. So it's quite multidisciplinary. You get to know like other sectors as well. Another thing also I would say is that you don't have on-call duties.
I mean, it sounds like you've mentioned everything I learned from an on-call standpoint, but without it being
exactly, without being on-call, exactly. So you don't, I mean, usually your weekends and your, I mean, I was a bit of workaholic, so I used to sometimes do audits and things over the weekends, but...
Sean, I don't believe
don't
it.
believe
Safoora,
that. Really?
workaholic.
No, it doesn't sound
yeah, I'm less workaholic now, so...
No, you're not. No, you're not.
Yes, I was very workaholic at that point. I used to do a lot of work over like audits and things over the weekend. And sometimes I used to follow my mental health patient over the weekends as well. Like if they were unwell, I used to sometimes call them over the weekend. But generally speaking, there is no expectation. So you usually have then you don't have on-calls or your weekends and things are for yourself. And another thing also is very good for, I would say, for our students. If they want to, for example, look for something very flexible, GP surgeries could be flexible. For example, you can work part-time for them.
Right.
Or there are a lot of opportunities now for remote working, which means that you get a laptop and you consult patient via telephone or video calls.
So that's something that's been kept from COVID, then you're still doing
Yes, it's been
telephone.
still going on. There are a lot of opportunities now around. So if you want to have a good work-life balance, for example, you'd prefer to work from home or have flexible timing, is quite very flexible as well.
Well, it sounds attractive.
Yeah, definitely.
I'm sold. I mean, you might not want me being a GP pharmacist or any kind of pharmacist, but it sounds great. So why then academia, Safoora? What motivated you to come back to university, which we're very, very grateful for?
Thank you.
And yeah, you still have that workaholic nature to you, I think.
I think it's gone down a little.
Well, it's not sustainable. I mean, it has to go down at some point. So yeah, why come back to the university? What motivated you?
So I always did like the teaching. So when I was working as a pharmacist, I used to do a lot of teaching. So especially in GP surgeries, I used to have regular teaching for GPs. I used to like have teaching sessions for GPs, nurses, paramedics, or my colleagues. And I used to have trainee GPs with me, like, or pharmacy technician and when I was working mental health hospital, I did have a lot of teachings. Perhaps Connor, you do a lot of them with your pre-regs coming. So I always did enjoy teaching anyways. That was something I did really enjoy, and I did enjoy teaching even before that as well. So it was something like, as I was a child, I always enjoyed explaining things to people.
Did you have a blackboard at home?
I did, actually.
So did I.
So
Wow.
yeah, so I used to have like other students when I was like in high school and others. So I had other students. Sometimes I used to have them like if they were weak in math and something, I used to do some teaching at home.
It's
so.
a natural thing. Yeah, it's
exactly.
in your personality.
It was in my personality. So I did always like the teaching. I quite really enjoy like explaining things to people. Another thing also interested me, obviously. I did like to come back to Brighton. So, when I left Brighton, I was always didn't like to come back somewhere, find my way back.
Pining for it.
I was finding a way to get back. I can remember when I was covering one of the surgeries is next to the university. And when I was driving there, I used to see the buildings of the university. And I was
glistening
always,
in the sun.
Honestly, I was always dreaming, I really like to go back again to Brighton University. It was the best time of my life was in Brighton University. So
That's so good to hear.
Isn't that positive? Love that.
it was, honestly, I always say to students, I always say to them, now you might find it difficult as a student, but believe me, this is the best time in your life, perhaps, for most of you.
That's almost uplifting, but also quite potentially quite sad as well.
I don't know. I'd probably say the same thing.
Would you?
I really enjoyed being at the University of Brighton, and I think coming back as a lecturer is quite nice to be able to give that back and have that same. It felt like a family. It felt like you could talk to people. That relationship between lecturers and what you were learning and what you were excited and enthused about. Kind of brought me back, so I'm glad that somebody else has said it out loud as well. So thank you, Safoora.
Yes, definitely. It's very nice. As I said, when I was driving back, I was dreaming about like coming. It was just I really found not because I'm a lecturer here now, but my experience as a student, I found lecturers were very good when I was. They were very supporting, and they were really very friendly. So obviously coming back to university as a lecturer where you've been there and you always dream to coming back someday, find your way back. That's why I also wanted to do a PhD as well, find a way, sneaking in.
And hope you're as friendly and nice as you remember your lecturers being.
I always try to be now. Like always, I try to be a lecturer that my own lecturer they were to me, like you, Sean.
Oh,
so I always try to be one of them. I always put it when I started this job. I said I want to be like them, how they made me feel.
Well, it's interesting when you were talking about your GP clinic list and the appointments that you had. It did make me think about appointments that we have with students, and I wondered if there was anything that you learned from managing. Your consultations with patients that you've brought over into interacting with students?
I think I have, perhaps. I mean, because of my background in mental health, I'm quite very good listener usually. And some stuff you learn about not being judgmental about people, and like people are very different. So I think that gives me some good understanding sometimes. Perhaps that sometimes make me less angry if there isn't like some of the students may not be able to do the good performance that they should do. Sometimes I'm a bit more understanding and gets angry with that in some situation. So yes, you get a good time management in some respects, and you also learn to work hard in general. You have to work hard in GP surgeries. Yeah. That's why most of the GPs work part-time, because it's really very hard to, it's a hard and demanding role. So you get some aspects of that. So at the start, when I started this job, I was feeling a little like more rushed than I am now, because you get used to that rush,
Yes.
You get used to that clinic type of things, and things needs to be done immediately and not waiting. So it was a little adjustment to learn that in academia is a little different.
Yeah, interesting. Did I have another question on the list?
I've been talking too much.
No, you're
you
not
haven't.
talking
I
too
think
much.
Everything
It's
you
great.
said has been fantastic.
Oh, thank you.
So I think you kind of thought back to being a student here and thinking about lecturers that you had.
Mm-hmm.
So thinking about students that we've got, what's one piece of advice, either through their undergraduate studies or at some point through their career, that you could give them on their path?
Yeah, so I always say to the students, first is that try to get engaged with the course. I mean, when I was doing the course, we were, I'm sure, Connor, you were similar. We were very engaged with the course. You were not, yeah?
Oh, I'm sure he
I
wasn't.
caught
He was at
you.
the back, smoking,
Yeah.
throwing paper
Having a nap.
aeroplanes.
Yeah, so I've always suggested the students always, I know that is that first and second year, you know, they say they don't count toward the degree, but they are actually very important because if you don't do well with your first and second year, don't put enough effort, then when you get to your third year, you really would perhaps struggle because a lot of things you learn on your first year and second year are also fundamental, both for studying your third and fourth year and also as a pharmacist.
Yeah.
Like for example, one example I would say pain case like they have in the first year. As a pharmacist, you are hugely involved with the pain. So if you don't learn that very well and you don't practice it very well, then you wouldn't be able to do a lot of tasks as a pharmacist. So I would say to them, try to get engaged as much as you can, and also dream big.
Oh, I like that.
Yeah, dream big. So dream big about like being the best you can, both in your as a student and as a future pharmacist, but also leave some time for enjoying yourself as well. But first thing is you are a student, so you should focus on being your study as well. So that's also a very important part of your time at university. So you have to have a good balance between them.
I like that, and I think well-being's been brought to the forefront a lot. So it's nice that you've just said, focus, work hard, but also have something that you enjoy.
Absolutely,
It's one
of the questions, isn't it, that we have for potential students or our applicants is about what you're doing outside of your studies and extracurricular activities. And for me, that question is always about: have you got something else that you can do? Because yes, absolutely, you've got to be motivated to learn, you've got to engage with the material, but it's so important to have something external as well to fill that bucket.
Mm-hmm.
Fill that
bucket. I see. I don't know. I don't know where that came from exactly.
I've got lots of buckets and the sand. What's that?
Oh gosh, well that's a different thing, isn't it?
Okay, fine.
For another time. But I feel like you need to have probably lots of buckets so that if one of them's toppling over and things that in your studies or at work aren't going so great, you might have your fitness bucket that is full, and that I don't know where I'm going.
Maybe the thing should be to juggle all of these buckets.
Oh, don't juggle buckets. That's a recipe for disaster. What's next then, Safoora, in this career development? And are you still dreaming big?
I'm still dreaming big. Yes, I would like to obviously start doing my PhD. I have been a little slow with that one because, you know, when first you join, there is a lot of things to adjust yourself at university life. So I'm planning now to do my PhD, hopefully. So that's something I want to do, and I would like to be more involved with the research as well, part of it. So my research interest, generally speaking, is about the management of mental health patients in general practice. One thing I have started doing it, but I'm really very at the start of it. That's why I said that I'm trying to write a book. Because we don't have a prescribing guideline for GP surgeries about mental health patients, so that's a really lack of resources in that point. So yeah, I mean, you can look at obviously the NICE guideline, but with mental health patients, we don't only use the NICE guideline. We have like Maudsley, we have Bazir, so it's very multi guideline. So there is a lack of resources there, which does the GPs. I know they struggle a lot with that. Sometimes they don't know what to prescribe for the complex cases. That's why my role was usually also. So my biggest dream is to write a prescribing guideline in psychiatry for GP surgeries for primary care clinicians.
Okay, just a couple of small goals then, a PhD and write a book.
Wow, yeah.
Good.
All be done by next September. If
No,
Well, maybe
definitely not.
we will invite you back in, maybe not in September, but a little bit further along and see how you're going with those, if that's okay, because that sounds
Yeah.
great. We've got one more question, which is a bit of an odd one.
Yeah.
We're asking all our guests the same thing, and so I want you to imagine that you're going to a remote island where you'll be the only healthcare professional to look after a population of around 100 people. You're allowed to take 3 health-related items with you. What are they and why?
Well, it's hard to say which 3 exactly. It's just if you're the only one. But I would go with the medications.
Okay.
There are 3 groups of medication I would have with me, definitely. Perhaps one of them would be definitely mental health medication, maybe for depression and anxiety, especially because if you're just in that island, 100 people on the round, I can imagine that could be quite very difficult and mentally challenging for the patients there.
Yes, it could.
So definitely a big bag of the mental health medications.
Hopefully all labelled.
All labeled, exactly, and not expired. So that would be something that I would do, and maybe as a part of that, some books about self-help as well. Because if there is no psychologist there, I'm not.
You are the only healthcare professional.
That's what I mean. So I'm not a
yeah.
specialist in doing psychotherapy. So I would perhaps take some books with me that patients can look at them and help themselves. Another one would be the pain medication, because I assume you would end up with some sort of pain and it's very uncomfortable.
Pain medication has come up before.
It has
which is
come up
interesting.
before, hasn't it?
Really?
Yes,
somebody
it
had
has.
my mind there.
Yes, they did. Yeah. I mean, I can see why it comes up. It's
Yeah, I guess.
It's something that you want solved, and it's something that you encounter quite a lot. So.
Yes, exactly. Another thing I think I would take would be antimicrobials, like antibiotics and antivirals as well. It's just because I think the infections would usually happen, especially on that remote island, and they could be quite very deadly as well if they don't be treated. So I guess these are the ones.
I think I'd feel quite safe on that island.
Yeah.
I think I would.
And Safoora in charge.
Exactly.
Yeah.
Physically and mentally.
Yeah.
Perfect.
Fine.
That's good.
And I guess the tag to that then is, what would you use to measure success on this island?
Well, the success would be a little difficult. I mean, it depends on how healthy people are, isn't it? Like, you might want to look at, like if you're treating mental health specialists, you can look at to see how the mental health of that. With 100 people, you can easily monitor it to see how people are feeling and if they are mentally well. About the infection, you can see like if they have improved, if you treated them, or like if there was any death, sadly, as a part of that. And I think in the pain it would be a bit of a difficult one, because even with pain medication, you might not be able to make people pain-free. And that's something I encounter also with my work at GP surgery. People want to be pain-free, but unfortunately, sometimes it's not possible. So at least improving their quality of life so they can be happy.
Because I think that's the tension, isn't it? Do you want to improve quality of life, or do you want to elongate longevity? And then I thought of a third one, actually, when you were talking, but I think it's the mental health angle as well, is do you want to, what's the word? Propagate is not the word, populate. So do you want to build on your 100 people? So with poor mental health, people are going to just go off on their own potentially and not be in a place where they could have sustainable relationships and bring on the next generation of people. So I don't know. I'm just putting another one in there. I'm talking absolute randomly today.
That was an interesting.
It's very interesting.
I'll take it with you.
I think I would be more interested about, I mean, obviously, people living longer is something perhaps most of the humans, they would, love to happen to them. But I think quality of life matters more than how long people are going to live.
I agree.
So I think my focus would be that people have a good quality of life. They have a good mental health and physical health as my first priority than how long they are going to live. I guess if you're mentally happy and generally like your mental health and physical health is good, you will live longer anyway. So that would come as a part of it. But general as in quality of life is very important.
Yeah, obviously all connected. Yeah. Super.
All linked. It's fun that you said pharmacist, and I've written down flexibility and variety, and I think that's where we're at with the role of a pharmacist. And I think it would be nice to invite you back at some point to tell us a little bit more about some of those mental health drugs.
Yeah,
so
yes,
students can learn a little bit more about some of those
Yeah,
classes.
good idea. Yeah.
Yes,
That'd be
definitely.
brilliant.
That would be great. I would really like that.
Good. Thank you so much for coming in.
Thank you for having me. And I'm always happy if students also want to ask about anything, because I had a couple of students coming to me asking they wanted to get into mental health and how they can. If you have any questions or anything, you want some tips about what I have got in my career, you want to find out about it, always more than happy, drop me an email.
Oh, perfect.
Fantastic.
Thank you.
Awesome. Thank you.
All right.
Thank you.
And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals, and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.